That question, how much bandwidth for development going forward, does raise a question of what might be in, what isn't in, what should be in. Do you have a view on some of that?
I do. Thanks very much, Alison, and thanks to Duncan. I think Duncan's done a terrific job of both identifying the areas of consensus between the parties, doing a very quick summary for those of us who haven't got around to reading the manifestos of what's in there on development in a very accurate way, I think, in trying to tease out some of the differences and the nuances, and then suggesting some of the challenges going forward. I've approached this question slightly differently. As we were chatting beforehand, we sort of talked that through, and I've identified really three issues, big issues as I see them, that might or might not feature in the agendas of whoever emerges from the election. And I think we're in a circumstance currently in this election campaign where, frankly, none of us know what the outcome of that election will be. So we can speculate what the Tories might do, or Labour Liberal Democrat coalition. What I'm going to talk through briefly in my 9.5 minutes is three big issues that I think that no serious UK government that is committed to poverty reduction can afford to ignore. And these are the three issues. The first is the whole question of food insecurity, hunger and nutrition. We had a situation in 2008 during the food price crisis when everyone was talking about this. I mean, this really was the issue of the time. You know, the Economist had it on its front page. Everybody, political leaders, had this as a high point of discussion and deliberation at their summits. Partly as a result of food prices falling from the peak of 2008, there's a sense in some quarters that this is an issue that's sort of been sorted or has gone away. But it seems to me that the underlying drivers of high food prices, of food insecurity, are still there. Population growth, access to water, urbanisation, deteriorating environmental conditions, all of these factors are likely to lead in the longer term to food prices rising, and in the context of rising population, clearly we need big increases in agricultural production and food production to meet the needs. And as Amartya Sen's been arguing for 30 years, it obviously isn't just about the amount of food, it's also about whether poor people get access to it. And we've got a context now where about 1 in 6 of the world's population is hungry, is not getting adequate nutrition. A big proportion of that number are children, so 195 million children under the age of 5, that's 1 in 3 of under 5-year-olds in the developing world are stunted, severely malnourished, with all of the implications for that. I think what is encouraging is that in the last 12 months, DFID has seized on this agenda, has actually produced a very impressive nutrition strategy in the last couple of months, literally the last 2 months. But I think the challenge for whoever forms the next government is whether they're serious about taking that forward and serious about implementing it. I think it was Robert Zellick, the head of the World Bank, who said about a year or so ago that the relevant bit of MDG 1 that talks about hunger and undernutrition was the neglected, the forgotten MDG. And I think he was right to do so. And I think for all of the achievements over the last 10 years from the current government, issues around nutrition and undernutrition have been neglected. And I think that the next government needs to recognise that not only in and of itself is this an important development issue to focus on, but in many ways it's the precursor for achieving greater progress against the MDGs as a whole. And one of the reasons we're not doing better on educational outcomes is because of some of the children going into school are malnourished, or health outcomes is because of the close causality between being undernourished and high levels of child mortality. So there is a pretty large consensus amongst the nutrition and broader health community about the kinds of things that you need to do to reduce undernutrition. And actually a lot of it starts even at the level before pregnancy. It's about whether mothers are appropriately nourished and so on. But I think that this is an issue that deserves much more focus and attention over the next 5 to 10 years from whoever emerges as the next government. So that's the first issue, really trying to prioritise hunger and malnutrition as a big issue that's been neglected, that deserves more attention. The second issue I want to talk about, which I'm conscious is possibly a bit more controversial, and I know that Duncan has blogged on it previously, and he and I probably agree on about 98% of development stuff, but we might possibly disagree a little bit on this, is the question of rapid population growth. And I think, again, there is something a bit curious about how the development community in general is reluctant to talk about the implications of very rapid increases in population. Well, the world's population is currently 6.8 billion. 40 years ago, it was 2.5 billion. There are various projections that are put forward by the UN Population Division which suggest that population could stabilise at anything between 7.8 billion or 11.7 billion. And are we seriously saying as a development community that we are indifferent between those outcomes? That we don't care whether it stabilises at a lower level or a higher level? It seems to me there is a massive argument that high fertility and rapid population growth, which tends to take place in the poorest countries, is a major challenge for development. And the development people and people that are concerned about making progress against the MDGs need to focus on it much more seriously and in a more concerted way than we've done in the past. I think the reason that we haven't grappled with it is a sort of sense, which I have a lot of sympathy for, that it could be construed as sort of blaming poor people for their poverty. You know, if only poor women in Nigeria didn't have 7 children, there wouldn't be a problem. You know, why don't they take more responsible action? And of course, that's a legitimate concern, and we don't want to give any succor to the arguments of authoritarians or people who believe in coercive approaches. But I think there is a very strong consensus that dates back actually to the 1994 Copenhagen meeting on population and development about the kinds of things you need to do. And it's a thoroughly progressive agenda, the kinds of things that you need to do to actually ensure that population stabilises. It's about empowering women, it's about access to education, it's about access to family planning, it's about raising the social status of women, it's about health, and it's about nutrition. And in societies where investment and policies have occurred that have led to those sorts of changes, what we see is a decline in fertility rates and the stabilisation of the population. So this is a progressive agenda which is about empowering women to make choices about how many children they want to have and how they want to space their families and so on. But it has big implications for the development goals that we commit ourselves to. I mean, just to give you some examples, the figures done by the UN Population Division suggest that on the current trajectory, Niger's population, Niger, remember, is one of the poorest countries in the world, will grow from 14 million today to 50 million. Uganda's population will rise from 27 million today to 130 million. Afghanistan's from 31 million to 82 million. If we think about the challenges facing those countries, do we think they're going to be easier or harder to deal with in the context of very rapid population growth of that kind? So there are things that we can do that are thoroughly progressive about empowerment that will help us to address those issues. And it strikes me as curious that actually none of the parties are really talking very much about this issue. It hasn't featured particularly over the last 10 years. There's been much less discussion of it by mainstream commentators in the development community, and I would say it's an issue that warrants serious consideration and discussion on the part of whoever forms the next UK government. And then the third issue, which perhaps is a topic we talk more about in these kinds of circles, but one nevertheless that I think that the next government needs to give more intelligent thought to, is the whole question of, if you like, equity and rights. We have a framework, as Duncan said, where basically for the last 10 years or so we've been very focused on the Millennium Development Goals. And I'm a big supporter of the Millennium Development Goals. I think the MDGs have given focus and political direction and energy to collective development efforts. But what they are, let's recall, is they are averages and aggregates, with the one exception of the MDG that relates to female and male access to education. And what they neglect, therefore, is the situation and the position of the poorest and the most marginalised. And we've tended to have an assumption that of the MDGs, the one that we really care about is the relevant bit of MDG 1, which is about income poverty. And the primary means, the primary driver of reducing income poverty is through economic growth. And I don't want to be misconstrued. Reducing income poverty is very important, and economic growth is very important as one of the policy instruments that we should use to reduce poverty. But we know that it's more complex than that. And I think that, again, I don't know whether I'm betraying any confidences. I had a conversation with a senior DFID official a couple of weeks ago who said, we're really struggling to get a coherent narrative on equity. You know, it's important, but we're not quite sure how we go about operationalising it. And I think the challenge for the next government is to say, we've got so far with a growth-focused approach, we've got so far with an MDG approach, but there are still vast pockets of poverty, what others have described as the chronically poor or the most marginalised, that we haven't yet brought the benefits of better education, better healthcare and so on to. What is our strategy for addressing that? And I think it's got to be a bit more sophisticated than just saying we want better governance. Of course we want better governance, whether that means better public administration or states that are more responsive to their citizens or more effective and transparent management of the finances. We want all of those things. But better governance surely also implies political systems that are more responsive to the needs of and respectful of the rights of the poorest and most marginalised communities. And I don't think that issue, which, let's face it, is a very complex one, has received the kind of attention that it warrants over the recent past. And I think the next government, if it's serious about the kind of poverty reduction goals that it talks about, will have to think a lot harder and more innovatively about the ways in which you improve the circumstances of the poorest and most marginalised. So putting equity centre stage and focusing a lot more on issues about rights and empowerment and justice seems to me to be central. And just perhaps to end on one interesting article I saw in the Lancet Medical Journal just 2 weeks ago, I think the Lancet is a weekly publication, 2 weeks ago, was a guy called Anthony Costello, who is an academic at the University College London, who does a lot of work on public health, had done some really interesting research in India and Nepal, I think it was, where empowering women in groups, getting women to talk about their circumstances, to talk about opportunities for accessing health and nutritional services, had actually led to a very significant reduction in levels of mortality, even without additional technology or services being put at their disposal. The very fact of empowering people and giving people opportunities to talk about their circumstance was a way in which better nutritional and health outcomes had occurred. So I think that empowerment theme is one that is critical and deserves much more attention over the next 5 to 10 years.
Okay, thank you.